Final video for chapter 22, and this is on lung diseases, and there is one slide on development, and that goes into kind of as we age. So we first start off by talking about chronic obstructive pulmonary disease, or COPD, and this is exemplified by chronic emphysema and chronic bronchitis. The key feature is irreversible damage in the ability to force air out of the lungs. Excuse me. Other common features include a history of smoking in 80% of patients, dyspnea or labored breathing, coughing and frequent pulmonary infections, and most patients develop hypoventilation accompanied by respiratory acidosis and hypoxemia. Remember, hypo means below, so they're not ventilating properly. We're going to talk about emphysema. So with emphysema, there is a permanent enlargement of the alveoli and destruction of the alveolar walls. This is going to result in a decrease in lung elasticity, and then there are three consequences. The first is that the individual has to use their accessory muscles to breathe. And this means that in addition to using the diaphragm and the external intercostals, the individual also has to use their scalenes, their sternocleidomastoids, and this is going to cause the person to become exhausted because they're going to use 10 to 15% more energy to breathe than normal. The second consequence is that trapped air causes hyperinflation, which is going to flatten out the diaphragm and cause the person to have an expanded barrel chest. Both of these things are going to reduce ventilation efficiency. The third consequence is damaged pulmonary capillaries are going to lead to an enlarged right ventricle. One of the hereditary factors for the disease include alpha-1 antitrypsin deficiency. Next, we talk about chronic bronchitis. So inhaled irritants cause chronic excessive mucus. The mucosae of the lower respiratory passages become inflamed and fibrosed, and then this is going to result in obstructed airways that impair lung ventilation and gas exchange. People that have this also have frequent pulmonary infections, and then risk factors include smoking and environmental pollutants. COPD symptoms and treatments. So the strength of a patient's innate respiratory drive is the reason behind different symptoms seen. You may see pink puffers. These people are usually thin because they burn a lot of energy breathing. They have near normal blood gases, and because of this, their skin color is normal. Then there are also blue bloaters. These patients are usually stocky. And then there's cyanosis due to hypoxia, so the skin takes on a bluish hue. Treatment includes bronchodilators, corticosteroids, oxygen, and sometimes lung volume reduction surgery, and then oxygen needs to be administered carefully. So with COPD, we have tobacco smoke and air pollution. We'll go this way first. We have continual bronchial irritation and inflammation. And then chronic bronchitis, we have excessive mucus production, chronic productive cough. Let's go this side. This alpha-1 antitrypsin deficiency. We have breakdown of elastin and connective tissues of lungs. And then emphysema would be the destruction of the alveolar walls, loss of lung elasticity. Both cause airway obstruction or air trapping, dyspnea, frequent infections, and this is going to lead to hypoventilation, hypoxemia, and respiratory acidosis. Asthma is sometimes classified as COPD, but it's acute, not chronic, and people who have asthma actually have periods of time where they are symptom-free. It's characterized by coughing, dyspnea, wheezing, and chest tightness, and active inflammation of airways precedes bronchospasms. I'm not going to ask you any questions about this bottom part of this slide, but I did want to mention that airway inflammation is an immune response caused by the release of interleukins produced by IgE and recruitments of inflammatory cells, and airways thickened with inflammatory exudate magnify the effect of bronchospasms. Tuberculosis is caused by the bacterium Mycobacterium tuberculosis. Symptoms include fever, night sweats, weight loss, racking cough, coughing up blood, and the treatment is a 12-month course of antibiotics. Unfortunately, there are some antibiotic-resistant strains, including some that are multi-drug resistant strains. Lung cancer is a leading cause of cancer death in North America. 90% of all cases are the result of smoking. The three most common types, I'm not going to ask you about these, I'm just going to mention them real fast. Adenocarcinoma, squamous cell carcinoma, and small cell carcinoma. So with lung cancer treatment, the most important thing would be early detection. That's going to be your key to survival. If metastasis has not occurred, this means that if the cancer has not spread, then at that point, what doctors will do is they will surgically remove the diseased lung tissue. If the cancer has spread, if it has metastasized, then the person will have to undergo radiation and chemotherapy. There are now several new therapies on the horizon. We now move into sleep apnea. This is a common disorder characterized by the temporary cessation of breathing during sleep. In other words, the person stops breathing during their sleep. Usually the person's not aware of a problem, and it can lead to excessive daytime sleepiness due to waking up several times each night. It can be up to 30 times per hour. Now, the number of times that a person can stop breathing per hour can go up higher than 30 times per hour. I will tell you that because my personal number is higher than 30 times per hour. Then there's obstructive sleep apnea, which is the most common type, and it's caused by a collapse of the upper airway. The pharynx muscles relax during sleep and sag, causing obstruction. Then we have central sleep apnea is caused by a reduced drive from the respiratory centers of the brainstem. The consequences of disrupted sleep are susceptibility to accidents, increased chronic illness like hypertension, heart disease, stroke, diabetes. Obstructive sleep apnea, though, can be treated by using a CPAP device, and CPAP stands for continuous positive airway pressure. The pressure from the CPAP device holds the airway open, preventing collapse. And then we have the final slide, which is on the developmental aspects of the respiratory system. At birth, the respiratory centers are activated, the alveoli inflate, and the lungs begin to function. It takes about 2 weeks after birth before the lungs are fully inflated. Respiratory rate is highest in newborns, about 40 to 80 breaths per minute, and then it slows until adulthood to about the 12 to 15 breaths per minute that we talked about earlier. Lungs continue to mature, and more alveoli are formed until young adulthood, and respiratory efficiency does decrease in old age. Here are your last two questions. You guys have an awesome day.